Good afternoon, Mr. Natarajan Raman. Thank you for agreeing to talking to JDF. We understand you are an app developer who, as a hobby, are interested in patient education. Could you please tell us how you got into education regarding patients in your app, Kuzhandai nalam?
Good afternoon, madam. It's a great pleasure to be here and be part of this JDF initiative. About the application, actually, this particular app, I got inspired to develop this app because of my kid, who is now 3.5 years old. So what happened was when my kid was just going through growing up. I could see that there are certain things where we could treat at home using the traditional methods as a first defense, and then when it did not work really, then we could go to the doctors. Most of the times what happened was the first defense mechanism really worked, and I was very surprised coming from a technology background and completely out of medicine. I have no knowledge as a layman. I was surprised by the techniques that were used, and I thought, okay, maybe there is some real value in this. I could see that this was working. Then I thought maybe it's time to actually take this. As I was at the time I started developing apps on Android. So I thought, okay, Android is the best platform to take this to the mass, because it's India penetration for Android is much more higher compared to that of iOS. So I thought, okay, I will start putting these things into an app. And as soon as I started, I could see that there are a lot of material which are in different places. So if you take a look at the app description, I give credit to all the sources. It's not something out of what I had or anything. So what I thought was, I'll put them together and then develop this particular app. The one thing that I thought was there were no apps in Tamil, especially, which and if you talk about rural masses, mothers who are in villages or somewhere in the different places, I thought if it is in Tamil, it will actually help them to read instead of in English. So that's where I got inspired and started developing this app.
Yes, the two things that particularly struck us was that the app was in Tamil, which there are very few apps in Tamil regarding health issues. The second was the fact that you had already 50,000 downloads of your app. This is in talking in how many months have you?
I think the app was there for around 8 months now. 8 months.
In 8 months, 50,000 is an extremely good number. And that means you are talking about a huge potential that exists there. So what do you see as a potential for this app, and why do you think so many people have actually downloaded it?
Yeah, again, no, that's a good question. What I can see is even if you search in Play Store, baby medicine, the first thing that comes up is one of the first two things our app gets listed, even though it's in Tamil. So basically, the first point that as you asked is, it's very important that this I have put around like 15 apps in Play Store so far. But if you look at the the real joy, they are not commercial apps, to be quite honest with you. It's all free apps that I have put. So the real joy comes in when the users, the end user gives you a feedback. And the best thing here is Play Store gives you an option where the users can actually talk to people and everything is visible. It's brings in the transparency. You can go and look at the Play Store, the kind of comments people have put in. They said, I have installed n number of apps, but this is the best app I have ever put. Such comments actually, and then they say that this is a must for for mom. That's something that we should have. And then people say that this has really helped my child recover. These are the things that actually makes your day. You feel like, okay, there is something that really something that we could do, like the squirrel doing it.
Correct.
Because there are many professionals, doctors and others, but digitizing this has really helped. And and as a parent, there is no horrible feeling than seeing your child suffer. Correct. That's one of the most depressing sights that you can ever have. And when your child can recover, and the children can really smile and bring joy, I thought nothing more than that. And second thing is, there is a lot of scope for apps in Tamil, especially healthcare. The reason why I see it, you will not believe me. As I told you, we have been to a forum where the top 50 developers for Android, we met in Google Bangalore. People were surprised by the number of downloads that I had. not only this particular Kuzhandai nalam app, there is one more app called Unave Marundu. It has got 1 lakh more downloads. So it's like healthcare, especially in Tamil. People are really looking for a lot of apps, because the mass is spread and there is a lot of apps in English, but there is nothing that can communicate with people. So I see a lot of potential for apps in Tamil, and especially in the healthcare area.
That's right. See, now as you know that information is out there for everybody, and in English there is a lot of information, but again even in English relevant to India is again there is a huge lacunae of apps targeting Indian culture and Indian food. For example, in diabetes, if you look at it, most of the apps only talk about Western food and not Indian food. We have very few apps telling how many calories your idli has and things like that. So I can see this huge potential for Tamil apps, and even every state having their own languages, so that access to information, which is already extremely so easy with an app, becomes even more so in a language you're comfortable with. Now, my next question is, what do you see yourself with this app in the next couple of years?
Yeah, thank you. The one thing is, what I wanted to mention was even one problem or one challenge, you should say, because every problem brings in a challenge and an opportunity. If you see, Google themselves, they acknowledged that the biggest challenge that they are facing in India is they are getting the user online, but they are not being able to retain them. Sustaining and making the Indian user to be on the internet is what they are finding very difficult. Not because of lack of data, but lack of content. The content that is available is not customized to the Indian users. Same goes with the healthcare thing also. So I definitely see that if the traditional methods, if it is in Tamil and can help people in who can understand Tamil, if you translate it into other languages, definitely it will be of great use for people actually, of different states and others, because the traditional means are even the one that professional authorizes, saying that this is the way how, because everything needs at the end of the day, if you look at it, there is nothing like a professional doctor who has been in the industry for long, who has seen patients, who interact with them, telling that organize it in such a way, and this is a way how this works, why this works. That makes everything to a perfect scenario. Unfortunately, I have not approached or I have not got the direction that I really wanted from a professional. As I told you, it's about just I wanted to digitize it. That's where I had kept it. But I think if we organize it in the right way with inputs from the real professionals, how it has to be, I see a tremendous scope for this, and definitely with interest from people and mentors like you, we can take it forward, and at the end of the day, it's about serving the society. It's not about making money, honestly, or it's not about, but if we can really bring healthcare deep root to these rural areas or villages, nothing like that, that's what I'm looking at.
So the other thing that you have developed is this app for communication with children who are challenged mentally, yes. So can you tell us how you went on to develop that app? Because you did not actually have a background in communication or in, or you have worked your way around that problem with your technology background. So how did you actually bring it about? And you have field tested it in your own NGO, which is in the school that you run. Can you give your experience how you went about doing that?
So what is this app is called as Easy Communication. The app is targeted for special children, that is children with dyslexia, autism, and people who wants to communicate, have challenge in communication. How I got into this was we have a school called Vasantham. Vasantham is in Mohapur East, Chennai. It's a school for special children where we have, it's a residential facility also. We have 65 children, and my family, we live with the children, so it's basically like it's a residential apartment where school where we live. So I after my marriage, it's basically where I got to be there with the children and know them. During nights, I could hear children screaming. Basically they want to tell something, but they don't know how to tell. My wife and my mother-in-law, they are professionals in the sense. My mother-in-law has been running the school for the last 27 years, and my wife is a speech therapist. So they were trying some apps which are really good actually in the industry, professionally developed and everything. But what they found was the user interface becoming complex, the user experience becoming complex. So one day my wife asked me, can you just develop something, this is a model that I want. And I want it to be simple. Simplicity is the ultimate sophistication. So then I thought, okay, I can develop, technology is something that I can do, but I need input from professionals like you. So they gave me the design, requirements, what they wanted. So I went on developing it. It's a very simple app in the sense, the moment you launch the app, you get a screen with 6 different grids. So the basic actions like eating, I am hungry, I want to use a washroom, I want to use I want to sleep, and these are yes and no, these are the communications. So the best thing in this is, you can customize it, not only on the picture front, on the language front also. Because like, if your mother is from, Andhra, she can speak in Telugu. Or even if the kid, whatever language they want to talk, you can, customize it. So on the kid, the moment they press it, it reaches, it can speak. Second thing I found here was, most of the times if you see the caretaker, will be the mom, the house, homemaker or anything, and the kid will be in a room, and mom will be stuck to them. They will not be able to move. Now, the best thing in this app is, we can actually put a number, and all these things are kept separate, so that the kids don't clutter with it. So the settings is a separate option, totally a different app kind of thing. So in the settings, you can set the number and the name of the person. So the moment, and you can enable whether the call should go or SMS should go. So even if the kid is, mother is not around or the caretaker is not around, if he presses, I want to use the washroom, immediately an SMS would go or a call would go to the number, so that, they would know what it is, and then, they can attend to their children. So, when we presented this idea, when I submitted this idea for Google developers, it was selected as one of the top 6 ideas out of the 80 presented, and they invited me to the conference at Google Bangalore, where we went and presented this idea. So, they were very impressed, because of which, the Google team, they were supposed to fly out of India, but they changed their plan, and then they came to, our school, Vasantham. They have made a picture, video about this app, as well as they themselves, they were also like, are they really using this? I want to see it. They were curious. So they came and then they saw kids using it, and they were very, very happy. So they made they're going to release this on their channels, Google channels. Main thing is, the purpose would be like, the awareness, especially the inclusion. As doctors, you would know very well how the society is when it comes to accepting these children. So our main goal is, how do we tell people that, it's not something, when the kid is crying or when he's yelling, basically he's trying to communicate something. It's not that, and so that's the kind of focus that we want to bring in here. So that's how easy communication has been helpful. Best thing is the HOD, that is Head of Department of Speech and Hearing, Dr. Rupa Nagarajan. She has been she was very impressed with the idea. So the professionals on that particular area, they have been very happy. And again, like Kuzhandai Nalam, they want to see how we can take this forward. So these are, some of the initiatives which actually can help the children or help the mass. So I think, healthcare, especially in a country like India, we have a lot of work to do.
That's right. JDF has been advocating technology for doctors so that they can equip themselves to treat patients better. We thank you very much for being with us today, and we hope that your apps will be downloaded more often, and we have a better understanding with doctors to get more apps in Tamil and possibly other languages. Yeah, thank you very much.
It has been a pleasure, ma'am. Thank you so much. Doctors are next to God, so I really encourage doctors to embrace technology. JDF has been a pioneer in this area, so I really would like to thank you for taking this initiative. Thank you so much.
Thank you.